I'm here. Don't worry.
No, no, stay on the camera. Stay on the
Yeah,
camera.
yeah, I'm here. It was download. Mhm.
Hello, everyone, and a very warm welcome to the 21st edition of Social Entrepreneurship for Innovation in Health course. We'll take a pause so that everybody can join the session. And if you're able to see us on screen and others are struggling, you can advise them to either refresh their browsers or rejoin the web link. Also, please don't forget to take the survey that you find below the screen that asks you, are you watching live? Please click yes to claim your extra credit points. Also, please know that this survey will not appear if you are watching a recorded session. All right, then let's begin. So welcome back to the second webinar of this season. As you're aware, the course is part of Global Making More Health initiative, which brings together a vibrant cohort of professionals from across public, private, and nonprofit sector committed to improving health access for people, animal, and communities around the world. Each week, we explore different aspects of entrepreneurship. Today, we have the pleasure of learning from an incredible change maker whose work exemplifies innovation, compassion, and resilience. So don't forget to drop your questions for her in the discussion forum, and we'll take as many as we can during the span of the session. And now, please join me to welcome our guest expert for today, Omar. Umra, before we start the conversation, I'd like to read out a small introduction of you. Umra is a community conservation strategist and a humanitarian from Kenya. She was born in Lamu and she is educated around the world. She holds a degree in neuroscience, psychology, and social justice. In 2015, she founded Safari Doctors. It's an organization that is delivering healthcare services to over 3,000 patients each month in remote parts of Kenya. She's also nurturing the next generation through a youth health ambassador program. Her groundbreaking work has earned a lot of international accolade. She has been the CNN hero. She was also named the UN Kenya of the Year. She's also part of the 2024 Ashoka Fellowship, and she also made history as one of the first and the youngest women to run for the governor of Lamu County during 2022 general elections. Welcome, Omra. It's an honor and pleasure for us to have you with us and have the opportunity to learn from you today.
Thank you, Indrani. That was an incredible introduction. So happy to be here, and welcome to everybody who's logged in.
Thank you, Umra. Umra, our course this week has a module where we are talking about entrepreneurial challenges and opportunities, and that's what we would like to learn from you from your experience. So, to begin our conversation, we'd love to hear your story about your professional journey as a social entrepreneur and what inspired you to get into the healthcare space and start Safari Doctors.
Thanks, Indrani. From a very young age, coming from a remote village of Lamu and experiencing the issue in commuting in order to access healthcare. I remember when I was about 10, 11, and my little sister got really ill, and they tried all these herbal traditional medicines, like everything you could think of under the moon, only for my mother to and dad to get us out of there as quick as possible to find out that I was actually cerebral malaria. But I'll never forget the journey that it took to get from the village, walk for 5 kilometers, get on a 4 hour boat ride, get on a flight to go to Nairobi, and then have her get the care that she needed. So Safari Doctors is out of the concept of the journey for change, and journey is the meaning of the word safari. So we travel to bring healthcare to the doorsteps of the communities that need it the most every month.
Beautiful. And do you want to talk a little bit more about? We know that Safari Doctor is delivering healthcare services to this very remote villages. I believe you have a CNN video to share with us. Do you want to play
So
that?
nothing will capture this journey more than sharing a clip with you. So allow me to do that, please.
Great.
It was kind of a sense of responsibility to come back to where I'm born. Being in the United States, life was getting too comfortable, going to a cubicle every day. Respiratory inhalants. How many people? I made the call to my mom and I was like, I'm coming back. No, I don't have a job, but maybe I need to be back home for the job to find me. Kidnapping put a dent not only on the tourism sector, but also on the development projects and aid work in the area. We have about 6 villages that have absolutely zero access to healthcare. We see monthly clinics in at least 10 of the villages, going in with a medical officer, making sure that the drugs in each facility are available. Today we had a 4:35 a.m. departure. It's like a 4-hour journey. Yeah, all of those. Being of the Muslim faith, being raised in that upbringing definitely gives a different connection with people. There is a lot of caution of, why are you going here? You're not supposed to. And as a woman running around pushing this project, it's like, why do that? Why not just stay home, get taken care of? MashaAllah, I don't want me. Being here, being close to home, to be able to fill some of the gaps in accessing healthcare. It's been an IV drip for life and purpose. You can see the impact in 0.1 seconds. I have absolutely zero regrets for taking the leap of faith. Wouldn't trade it for anything in the world right now.
Wow, that was incredible. So, Umra, we had slight issue with listening to the video, but what we are going to do is we are going to provide the video in the discussion forum, and I'm sure it's a worth watch. I also loved when you were receiving this honor and you said we may be of any skin color, but we all bleed red. So that was really beautiful and it touched. I'm like somebody like you who kind of gave up a career, a budding career in US because you felt more comfortable and you had a calling. So it was a story of incredible courage and taking ability to take bold decisions. So congratulations, Umra, for doing what you have done.
Thank you
So,
so much.
Umra, I'm going to come to a very candid question to you. Okay, you are a social entrepreneur, you started an enterprise, it's creating good impact. But in your experience, what were some of the misconceptions or myths that you had about social entrepreneurship, particularly in the area of healthcare and community outreach?
So when you get into the realm of social entrepreneurship, is that you're taking this responsibility of, identifying an issue, how you feel would best tackle it. So there's a process that you need to go into, especially when you're working with sensitive communities, whether it's children, marginalized people, conflict areas. So you have to have a really strong compass, whether it's like, moral integrity, you're going to work in mobilizing resources. So balancing that dynamic. I remember we had one particular issue during the COVID pandemic where we felt like, we're making an impact. Our outreaches, we decided we'd still do it. And then a case came out around COVID. And so us like, sharing that as like a precautionary, like, guys, they're alert that COVID is in Lamu, just became the most negative campaign against the work that we do, that,
Wow.
this is not true, it's not a disease that would make it all the way. We're in an island over here and you're just doing it for, for the clout and getting the resources needed for this. So it's a very delicate issue, especially today in this cancel culture that we live in. So being able to have have the right team, the right advisory mechanism in place, the security backup on your side as well as we go into these, sensitive locations. So social entrepreneurship it recalls this. You need to have a full picture in how you're going to navigate the terrain that you're in.
Mhm.
Yeah.
Completely agree. I mean, I can't, every time you say something, I just say, like, it's a story of courage. Courage of you, courage of your team, because you are operating in a place which has the military militant situation. And of course, to do anything there and even to think of, like, mobilizing a community outreach program is incredible. So I have a very interesting question for you, Omra, which has come from Nishika Pawar, one of our learners. And Nishika is asking, if you look back in your journey, what's one piece of advice you wish you had known when you started Safari Doctors?
Wow. If I look back at the 10 years and one piece of advice that I wish I had known is the level of commitment that it requires and how can you figure out how to grow yourself because everyone is looking up to, the guidance, the questions. So I wish I had a better idea or that support system of, what, this thing has the potential of scaling to a certain point, and this is what you need to have in your toolbox in order to navigate that space.
Beautiful. Great. Umra, I'd like to dive into your early days of journey and would, as you just spoke about, like, some things that you would have wanted to be better prepared of. So I would like to know that when you started your journey in your early days, how did you identify opportunities? And once you spotted them, how did you go about pursuing them?
So the first belief is that everything is an opportunity. That's the mindset. Whether it's raining, that's an opportunity. It's sunny, that's an opportunity. And especially in the negative experiences, is that's great opportunity to make a positive impact. So for me, I remember it was June 15th, and I got a phone call. I thought it was there was like a lot of missed calls. Like, wow, it's my birthday. So many people are calling and remembering me. And then only to find out June 15, 2014 was Lamo's biggest terror attack that happened,
Oh,
killing over 100 young men. Yeah, and it was like all over the news. It was like literally like a butchering massacre had happened. And everyone's like, where are you? You know what's happening in Lamo. Are you okay? And because I was in the US at that point, it was the time difference. It was earlier for me, is where because of that situation is what triggered like a very core part of my identity, where I'm from, who I am. And I'm like, that's where I need to be. What am I doing here? So challenges and opportunities, I believe that especially in the face of hardship is where in lays the greatest opportunity to be a human being of value in your community or in the world in general.
I completely agree that, you need to see an opportunity everywhere, even in challenges. So it was
Especially
very
challenges. Yeah.
in every challenge, yes. Great. Um,
Mhm.
Omra, one of the most powerful aspects of your organization is that it blends purpose with action. So we know that all this that you do, all the bold work that you're doing has its own set of challenges. It can be funding, it can be logistics, planning the operations. So I'm sure a lot of our learners would love to hear from you. How do you tackle challenges and setback? Can you give us some examples of how you have faced some challenges and tackled it, and what lessons you carry with you
Yeah.
from those experiences?
I'll go back to the COVID pandemic example where we had one of our staff member was one of the first persons to be identified with COVID and have to go into isolation. And I remember that big discussion of, are we still going to, Safari Doctors is about travel. It's about going into communities. Does this mean we're shutting our doors as an organization, but we're preaching healthcare even in the toughest of situations? So I remember right at that time making an emergency call to our board members first for consultation and guidance. And I'll never forget, they're like, Umra, you guys are the ones on the ground. You have to decide with your team on that one. And whatever you decide, we will just ensure that it's done in the most effective way for you. And then we had a meeting with the entire team and the whole thing, like, should we do it? And the team, like, if we don't do it, then it's like we've hung up our quotes and we're not, standing for it, believing. But I remember it was in that challenge, it was that support for those that, sit away from the office, realizing that this is not our call to make, and for the staff kind of owning that situation and being like, we're going to go out and do this. And then moving in now to how to overcome the challenge. We need to make sure if we're doing our camps, we have our masks over there. We need to make sure there's security. We need to make sure that, spacing. So then it became more about organizing how to effectively overcome the challenge versus being like, here's an issue, let's close doors and let's go. The second example I remember, which was a little bit more scary for me, is that January 3rd, was it 2021? Right, like 2 days before our outreach, the Navy base, the US Navy base located in Lamu was ambushed, and the total raid with Al-Shabaab. And in 2 days, we're supposed to be going out for the clinic. And it was like, okay, this is literally in the area what's happening. And the team was like, we know that this situation is a government issue, and we know where we're going, how to get there and bypass this route. And the team went out, and I remember just being on the boat praying and trying not to show any signs of concern on my part, but taking the necessary precaution and having a team that's like, we have to do this, because if we're worried, what about the people that we're going to serve who are in these villages? So yeah, so it's about not seeing a challenge as a full stop. It can't be a full stop. It has to be like, how do we navigate the situation? And true, sometimes you will have to make that call to be like, okay, this doesn't make sense. We have had done that in the past where, okay, we can postpone or we can redirect. So, but having that support system and a team and making it a very inclusive decision versus, whatever it is, you have to get up, pack, the medicines, let's go kind of thing. It's been a very shared responsibility in making these decisions. Yeah.
Beautiful. So, Umra, what I'm hearing you say is that whether you have a challenge, you have to count on people who are counting on you. And if you have to count on you, then you will need to have the right team to depend on to make that decision, which is an inclusive decision. So, yeah, I think it's a great learning for everyone that, first of all, when you see a challenge, the first thing that should pop up in everybody's head is those people who are counting on you. So it gives you the strength to see the light, like end of the tunnel, I would say. Umra, I have another interesting question from one of the learners, Mariam Kalajas. And Mariam is asking, how can we build trust with people to begin to intervene in a situation of social vulnerability?
Mariam, that's a very big and important question, because you're not moving far if you do this. My favorite African proverb, my second favorite, it says, if you want to go fast, go alone. If you want to go far, you have to go together. And for us, how we are able to harness that within the team is that first, your intention has to be pure. Because I believe there's nothing stronger than energy. Call it vibes, call it, whatever makes sense. But you have to have that good intention, and you'd be surprised how that awakens or connects you to other, good intentions. When I look at what we do, from the boat captain, the receptionist, the doctor, it's like the vet that we use. There's just that connected purpose that we have, and then we also have to make it intentional. The team that we put together, or the community members that we rely on? Is it something as simple as, remembering birthdays or what someone is going through outside the regular, clock in, clock out situation? Is it all of us showing up for a wedding when we can, or representing one another in human issues? Because at the end of the day, we all show up with our job descriptions, but what actually matters the most is what happens outside our workplaces. Yet we spend so much time together. So the trust is earned. It's not really built, and it's earned from the energy, the compassion that we have for one another. It's issues around solidarity, how somebody feels like they can rely on you and you can rely on them. If I go in and I see, there's a mess or a spill of tea, it's how I go in and pick up the mop and clean that up, versus, feel like, oh, it's not my job, and yell at somebody else. So, and that's something I learned really powerfully from my previous work when I was at Open Society in Eastern Africa, from my bosses, where I was like, oh, this is like a very linear kind of existence that you feel you can trust. You can, if you're stuck, you can ask for help, or you can celebrate one another's wins and so forth. And it's the most important ingredient in social entrepreneurship.
Beautiful. So trust is earned and not built. So great, great lesson. Thank you, Umra. Umra, also running an initiative like Safari Doctors requires you to juggle through lots of roles, like as a visionary, as a leader, as a fundraiser, and I believe sometimes also as a first responder. So how do you manage yourself? What strategies you employ on yourself to manage your time, your resources, your priorities, especially in a dynamic, high-stake environment?
I'm open to suggestions right now. So if anyone has some critical skills on management, it's a constant juggle and dropping balls a lot of the time, and being okay. I've learned to be okay with myself dropping balls. So that's one thing. But the biggest thing is delegation. It's funny how I feel like a lot of this discussion is centered around how you build a team, whether it's one person or two people or 50 people. So before it was very, very hard. You go in from you're the one on the board, you're chopping tomatoes, you're like, is the mattress on board? It was like literally having to go through everything. But I think with the organization now growing and scaling, is having the right team, and especially like recently bringing in a deputy director has like changed my life completely. So learning now that Safari Doctors is beyond me as an individual, and it's more about creating that right delegation, and not being too macro or too micro around it, being available for the critical feedback. So that's how I did, and trying to set aside some time of something at least that you're passionate about, that's beyond what it is that you're working on as a social entrepreneur. And for me now, I found that gives a little bit more of a balance, because you don't feel like this is your end all be all, although it is your end all be all. But where can you get an extra grasp of air? It could be something as basic. Like I started knitting with my daughter, and it was like made all the difference. All of a sudden, you have something you can totally flip your brain and go there. It could be something you do once a week. So it's really critical to find that balance of where you can get your well refilled. Because as a social entrepreneur, like you're constantly taking water out of your well. Yeah.
Great. So what I heard you, I think three important things which I'm able to recollect is that definitely you need to learn to drop balls. That's the most important one. And then also depend on your team. You have a team to do something. So believe in delegation. And if you have an important role which can complement you and give you strength, then identify that. So you got a deputy director. So great. Umra, you've made so many bold decisions in your journey so far, right? From having a booming career to kind of following your calling one fine day and returning home when you had no job. saying that the job will find you, and then kind of, engaging with this remote community, which was almost overlooked by everybody, including the system. So that takes a lot of courage. So I'm sure that while it takes a lot of courage to have sustained resilience, you have to have some ways to deal with setback. So how do you deal with setbacks? How do you stay grounded? And what role does perseverance play in keeping your mission alive?
And Rania, honestly, for me, it's a very basic. I'm like, this is what I'm doing, what we're experiencing is just a drop in the ocean. And as Rumi says that, we're an ocean in a drop. It's I think is the magic of what we do. I just think of look at what's happening at the global scale. I put things into context. I go for the law of relativity all the time, and it really humbles me to no other level. And if I'm looking to someday run a country, what's this? This is like it's just a little mental exercise, like a puzzle. So that's what I use. And then you look at it in proportion to what people are going to. What I'm doing is nothing compared to that woman who's in, having an emergency labor in the middle of nowhere. Like this is nothing compared to that. So I always go back to the law of relativity and I just tell myself, Omar, you're doing what you do because you can. And there's so much more to be done. There's so much need that we all need to step up, and at the end of the day it's not that serious as long as you're doing your darn best.
You remind me of one of our very famous freedom fighters in my country, India, Mahatma Gandhi. He also preached and he said, when you feel very low and underprivileged, look at somebody who is lower in position than you, and like a beggar, or like, somebody who has less privilege than you. And then you will realize how privileged you are. So you're exactly echoing
Really
that.
powerful, a really powerful mantra. Then it just, makes you get out of bed. It makes you get on that boat again. And you just keep going. You just keep going and feel grateful that you have that privilege to be able to do something about that situation. Yeah.
Great. Umra, we also have some questions coming from our participants, so I'm going to take them. So one of the questions, which is also a question that I wanted to ask, and Agatha Jegaleska, I'm sorry if I'm pronouncing you wrongly, Agatha, but she is asking, can you tell us about the logistics of safari doctors? What are the biggest logistical challenges that safari doctor faces, and how do you overcome them?
Logistics, that's the magic word. When we started, like, are you a doctor, do you do this? They're like, no, we're just logisticians, we're just matchmakers in the healthcare industry. So when we first started, I remember it was just about, I have this kind of fascination with the puzzles, right? So when I see, I was like, okay, we need medicines, we need medicals, we need a boat, we need. So what are the things that we need in order to make sure that these vaccines and these women get their reproductive health care service at their door? And say, okay, call the hotel, the doctors, we have 2 doctors, call the airline, they'll give us a free ticket, get the hotel, we'll get a free night. And then so and so has a boat, we'll do this. And then, okay, we only have to pay for the medicines, but we find a place that gives them like at wholesale prices. So that's how it all started. And it was all because it was just me and Kalu, a nurse, and a motorbike. I remember somebody donated a motorbike. We just had to fuel it. And then the vaccines were free from the facility. So it just started as this jigsaw puzzle to put fuel, Kalu on a motorbike, and some medicines. And then he would go out to 5 villages and see 100 women, like, per village on average. So that's how the basic logistics started. And I had done this before in high school. It was like a project of do a campaign and organize an awareness campaign, call the mall, call the newspaper. So it's interesting to see how what you're passionate or what you're good at or what drives you, you can translate that into something very purposeful. But then now today, as we got that CNN award, and then the first thing I had to do was, onboard a finance and human rights and HR, human relations office resources. And then we're like, okay, we did a fundraising, got a boat so that we're not relying on other people's boat. I remember for the first year we were borrowing internet off of the office next door. And now it's like, okay, we can get our own Wi-Fi and printer as well. So it was like, it started with these little big wins in logistics and not thinking of something. I always tell my kid, don't think of something as like a big problem. Break down that puzzle, just start putting little pieces together. And then the big picture is when you're like, oh, this is what the big picture was. So today we have in-house two boats. We have an in-house captain. It entails 2 weeks going out on the team is out for 2 weeks out of a month. So it starts with logistics in the office, ordering medicines from Nairobi, getting doctors that want to volunteer in addition to the in-house medics that we have. Antonetta, the vet, orders her animal medicine. And then like 6 a.m. in the morning, since we're no longer going with a very slow boat, we have our own big speedboat. Everyone loads everything on the boat. They go out to a village in the morning, a village in the afternoon, and then in the evening we sleep out. The team now sleeps out. And then the next day they go to a village in the morning, lunch at like a local woman's house who's like we contract to do the meals, and then sleep at her house and then do that. So that happens for about 1 week in one side of the county, the other week the other side of the county, visiting about a dozen villages in a month. So it's like a safari, but for a totally different clientele. And we say this one is a journey between life and death. It's not the journey of going to the wilderness and seeing the wild and glamping kind of thing. So I hope that answers your question.
Yes, Agatha, I'm sure it's like a magical safari. You started like with 5 villages, and now you're going to like so many villages. Started with 100 patients and now to 3,000 and plus. And just believing that help is going to come in and counting on the communities so much, who will host you, who will feed you, who will be part of you. I'm sure. I mean, you started a whole initiative, which is the Youth Health Ambassador Program, but they are the ones who are your link to let you know about what the issues are there in the community so that you can prepare for your safari. So it's a beautiful way in which kind of, you're doing this. A lot of our participants are also asking you what kind of partnerships have been essential for safari doctors to get operationalized.
First partnership is your who you're serving. That's the biggest partnership you could possibly have, because we always say we're grateful for the communities that are allowing us to be of service. Because we have seen initiatives going to places and being like, dismissed, or you're not able to deliver a service that you might think makes sense. So that's the first key partnership, is who your beneficiary is being okay with the program that you're running. And then the other one was the stakeholders within the community itself. Like I said, whether it's a hotel, were linked to the issue, and for that it's also of value to be associated to that issue. Like I know we have the airline Safari Link. It's one of the biggest airlines that does travel into areas, into these safari hotspots, and we're like, okay, then can we have a partnership to have at least a flight or two every month to bring in our doctors? So there's such partners that are linked to the issues. And then obviously our work entails vigorous fundraising. So we have a donor base that we have to constantly reach out to, update on our work as well, do our reportings. And last, the number 4 is the government, local government, whether it's the Ministry of Health in our youth programs and how we are able to access schools, education. And then there's the Ministry of Health. Sometimes we might do a tournament for around reproductive health and play football. Then you engage the Ministry of Sports. So having that government link. So number 1 is the community. Number 2 is partners who are linked to the issue. Number 3 is your funders. And number 4 is your stakeholders, your government collaborations. Yeah.
Great. Umra, just because you said number 1 is community, that brings me to another side of the question that I have, the next question that I have for you. It is quite evident from everything that you have shared so far that Safari Doctor isn't just providing services, it's also listening to the communities, it's learning, and it's also kind of, understanding the deeper issues that the communities have. So, what advice do you have for our learners when they have to identify an underlying cause of a social problem that they care about, and how do they approach that?
So in writing, it has to be a bottom-up approach
Mm.
in whatever it is you're tackling or you want to introduce, and that whether it's commercial venture of starting an eyeglasses company or whether it's going to drill a well. There's a very famous story I have to share to you, time permitting. It's about this group visits a community and they see that kids are traveling long distances to fetch water from the village, and it's
Mhm.
like, we can just dig a well right here, but it just went in, and we all come in and we assume that this is a solution. So they go in, build a well, and then come in later to do the assessment, and it's like, no one's allowed, the kids are not allowed to use the well.
Oh.
And it was like, oh, why are they not allowed to use the well? The water's right here. Instead, they're walking like half an hour to an hour to and fro. And
Mhm.
then the community is like, this is the only time that we get to be intimate with our spouses. Like when kids have all gone to fetch water, or else there'll be no more kids in 10 years because,
Ah.
they live in huts, the close proximity. And then, like, this is also the time that kids, socialize, get to learn, they go into the wilderness, and play with each other. And so just waking up and fetching water here doesn't make sense. So that goes to the answers that you cannot do it from a top-down approach at all. It has to come from the ground.
Thank you for saying that. We also have an article in this module where we were talking about how a bottoms up approach is important. And we had this similar kind of an example where a farmer community was being oriented about using a certain fertilizer for improving production in Bangladesh. And the farmers never used it. I mean, they took the subsidy, but they never used it. And when there was a survey being done to ask like why they didn't use, and they said just because it doesn't make sense. We have so much of rain here, whatever we put is going to get out, so we need something inside the soil and not to spray over the crop. So that's where I think something what you're saying is that we need to understand the ground realities before we try to complement with solutions. um, Omra, I've got more questions from you from the audience. So we've got Mohammed Taki Yasir and Elvin asking you, how do you balance cultural sensitivity with delivering modern healthcare in remote communities? Does your team balance modern medicine and also traditional medicine?
So that is a very another powerful question, is how do we navigate that balance between traditional practices and modern? And we see it a lot in deliveries, midwives.
Mm.
Been there for centuries, and then now all of a sudden coming in, being sidelined by, women have to go to a facility, and then they're not factored into that process because that was also a livelihood for, this practice within a village, someone who would play such a critical role also in the fabric of the community.
Mm.
So as safari doctors, we haven't done a good job at all of going into the nuances of traditional medicines or traditional healing, because we go in, especially around immunizations, reproductive health, and over-the-counter
Mm.
medicines. So they are traditional healers within the communities, and but what's tackling, and you can't compete with, is the issue around poverty. Whether you're talking of clean water access, nutrition, as well, because that's another thing we try to say, is that okay, there is that need for traditional practices where they work, yet at the same time we are in a society that's not consuming the same diet that was there before,
Correct.
or the same environmental. So it's a very sensitive juggle that we have to. But we as an institution haven't looked into what it is that we can introduce or follow up. There's what we do traditionally, but it's not in textbook per se.
And did you ever face any cultural resistance because you are trying to
No,
employ?
there's enough. No, there isn't a cultural resistance because there's such a strong need for the intervention that we're doing. So we haven't, knock on wood, until today. If anything, it's somebody be like, okay, they can have, because our community and the staff of the team that we have are from the same area. So it's not like we're bringing in, a team from Alaska or something to be like, okay, we're bringing you foreign intervention. So it would be like a clinical officer that can be like, okay, you're taking these, then you're fine if this is working for you. Or do you need an intervention of this kind of medicine? So there isn't much of like a tug of war or anything around that. Yeah.
Great. Also, Umra, can you tell us more about the role of youth and the younger generation in advancing community health and innovating in healthcare in general?
So if you look at in like sub-Saharan Africa, over 70% of our population is in rural area. And then you're talking like more than half of it is like young people on the continent, which in a few years, 1 to 4 of us on the planet will be from the continent. So if we're looking at this useful entity of a workforce of people who are willing to get on that safari, on that journey, on a phone call, versus the model that has been of community health workers being looked at as more senior or seasoned community members. And especially when we're tackling issues around reproductive health and immunizations, which is where most of our indicators lay, is not this. What's happening is as a result of information or lack of at a younger age, whether it's early marriage, whether it's FGM practices. So that's when it was just like a common sense kind of thing we stumbled on. It's like, wait a minute, young kids, at school level, high school level, where are they getting their information from? This is when people are getting married in the early 20s, right? Or late teens, right? Out after having gone through school. So what we decided to do is start a program where we're like, okay, we'll identify a bunch of youth in the communities that we go in. We don't do the identifying, the community does. Engage the chief, engage the elders to tell us who is the most vibrant youth that could be an ambassador around issues of healthcare. And then conduct quarterly trainings, get their first aid, get their community health worker certification, get them the exposure, leadership training as well is one of them. So it was first aid, leadership, CHW, and then the fourth one skips my mind. And for them, it's like it's a platform where they can engage with other youth. Like we have 60 per year. They can be our links to the community. They have that sense of pride that, we are Safari Doctors Ambassador. Therefore, if there was a referral, they could follow up on it. A job opportunity opens up, we tap into that pool. So like right now, about 3 of them have been absorbed as full-time staff in-house. So just being more intentional about engaging and bringing on board youth as agents of change in healthcare, or else we are facing like treating it like a cancer, whereas we're rushing to the healing and oh my God, why is this happening in our society? But we're like, okay, let's go to the root cause of the situation and be very intentional about healthcare as prevention of illness, prevention of misinformation, and then looking at how this would improve our health indicators.
That's so, I will say, a very smart approach that you are actually picking up the most important link from the communities, the youth, and empowering with the right information that then changes the situation on the ground because they are bringing those broken links and with something that can help them see the impact that they want to see. So thank you for sharing that, Umra.
I'll add in, Rani, some of the most exciting also role that the young people play is that we're in rural areas and we see a lot of referrals. And then it's a referral from somebody from a rural area. She'd be like, oh, you have to go to the city. And it's like, how am I going to get there? What am I going to do? And we just pick up Safari Doctors Youth Ambassador and they're happy, willing, available, make some extra income and travel for a week and go to a different town and follow up on this referral, which you wouldn't get somebody who has responsibilities, kids to care, or they have a job that they have to attend. So it's been a very exciting project to see how it's unlocking opportunities on both sides.
Completely, because it gives youth the power to say that we can make a difference and see this is how we are contributing. Like, we are getting you at a time of crisis somewhere you should be. So it's a very powerful approach. I have another question which a lot of our learners want to know from you. Our course is about entrepreneurship, which means that we are looking at making a change from within rather than starting something. So we would love to know from you, how do you think entrepreneurs from private sector and social entrepreneurs can work together to develop innovations for community healthcare?
Oh, that is like the biggest opportunity from within to be able to leverage where you're working an existing brand or entity. Because, like I said, one of the challenges at the beginning when you asked me was that where do we seek these new ideas, where everyone is kind of like looking up to the direction. So you as an entrepreneur, you're coming on board with that ownership mentality as well. And being in that right work environment that actually allows and acknowledges that is so vital. I would look at the example of Fahmi, our boat captain. He's like, this youthful guy. He's now, when he started, he was in his mid-20s, and he's a football fanatic, like, just football. He's just Arsenal, blah, 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 facts, there'll be even his language. And so one of the things that came up, I was like, we're healthcare, it's the youth. We're like, let's hold a tournament and make it around safe sex and reproductive rights. And
Wow.
he goes out and he knows all the teams, the captains, the referees. He does the league structure. He's like, no, you need to have this many teams. And then in order to have the playoffs, and then we need to do the semis. And then, these are the referees. So this is like it would seem so unrelated, but it turned out to be such a strong component of our youth program.
Mm-hmm.
And that I would properly term it as, a social entrepreneurship. He's a boat captain. He's within the organization, and here's something that he has put together that now we do on an annual basis as part of our programming. So, and that leads now to the level of, we can go out and now get sponsorship from the corporate sector in order to support this football league. That's the biggest league that we have in the region, where we do our services. So that's how I saw the public-private partnership, the entrepreneurship coming out as well at the end to achieve that goal of improving reproductive health indicators.
So lovely. So am I hearing you right? So are you saying that entrepreneurs from inside the social enterprise are connecting with the entrepreneurs in the private sector with some innovation, like in your case, the football tournament, and then kind of bringing a bigger community to work together at the end of the day for the benefit of the community and healthcare?
Absolutely right. Yeah.
Great. Umra, I mean, like, I want to go on and on. I have so many questions, and I know that you have so much experience. Last 10 years is like, I will say, a gamut of, I will say, gold or like diamond for us to learn from you. But sadly, we have to kind of look at the time, and we're just like 10 minutes away from the session. So sadly, we have to wrap up this great conversation and move to the final reflection that we want from you. And that is like from this huge experience that you have. Maybe it's 10 years, but not just 10 years. I will say it's like 10 million experiences that you bring, in different facets. From your experience, what lessons of social entrepreneurship can be applied by social entrepreneurs, especially as they are trying to transform systems from within?
I use a really good slogan. Nike say just do it, right? So Nike, we say if you see something, do something about it, right? That New York subway metro that you hear over and over again. So I would say there's always room to improve something, to innovate. Always room. It could be even how a survey form is filled within your organization. It could be even how you design a particular product or service, like getting that extra feedback of what could be done better. And that's what we've seen with the work that we do. We started, it was just healthcare, women and children. And then it was like, oh, the youth, let's bring that on board. Then it was like the vet program. How do we incorporate like the One Health? So just like a human being, you're growing. So I think there's no reason that the work that we do shouldn't be doing that. Like once you're stagnant, then it means we should, pack up and just call it a day. So there's always room to innovate and improve, however small and however big. And that's both in the private and the public sector as well. So I would say keep innovating. You have to keep innovating.
So just do it, keep innovating. Any ideas of like, how do you pitch it to say leadership and convince them? Because that is one of the hardest thing that the entrepreneurs find is like to have it sold to the people who will say, okay, go ahead and do it.
So if you're in-house, I would say get a fan as well, like and even if it's not somebody to help you pitch it, but just somebody to help you really believe in it and have the extra courage to do it. I remember when starting Safari Doctors, I just mentioned it to a friend, like I'm thinking of doing this. And then the next thing I know, she sent an email to a friend, like, guess what Umar is doing in Lamu? And I was like, oh my God, you think it's possible and it's already happening, and that gives you that nudge, like when you don't want to jump into a cold swimming pool and then you have that person who just like tips you in. And it's not nice at first, but then you're like, okay, I did want to go in the first place, so here I am. So I'd say that's the first thing, is just get yourself a little cheerleader, where it could even be your friend or your mom or anybody like that. And then how do you do it well is that once you know your audience, who you're going to, like I know there's this person I can only talk to if it's over a cup of coffee, and then they're okay. Or I know this person I need a PowerPoint in order to make. So know your audience as well, like who that person is, and how to best get that hook into getting their interest in what you're doing. So like let's say the last example, like so we have the biggest telecom company, that the CEO, when it was healthcare, was like, just talk to him about maternal health. If anything's to do with maternal health, because of what his mother went through, it's an instant connection. So know your audience, on how to pitch what you have, and have the person to push you in that swimming pool at the end of the day.
Great. So know your audience, have a champion, and know where and when to say. Like if it has to be on a cup of coffee, then find that opportunity. Great. It was an incredible session with you, Umra. It was a very enriching conversation, and we have lots more that we want to hear from you. But in interest of time, I'll bring up my final question asking you, do you have any final piece of advice for our learners who are about to start their journey of social impact?
The last piece of advice,
Yeah.
is that I personally am already a big fan of the fact that you have something that you want to contribute to the society and make that impact. So, and the I said I had a second favorite saying. My first favorite saying is that if you think you're too small to make a difference, always think of the mosquito. Then you have not spent a night with a mosquito, because it is like it would ruin your whole evening. It would disrupt everything, and it's just like literally something that big. So I say just keep buzzing and do what you have to do. It's needed, especially in the world that we live in right now, where it's so interconnected, and every little step in the right direction makes all the difference.
Great. So yeah, remember the mosquito and make the right buzz. Thank you, Umra, for being with us today. And it was a true privilege for us to hear from you, to host you, and to learn from you so many things, which probably somewhere we knew it, but it's getting like reinforced with all that you said. So thank you so much. And we wish you all the very best for your future, for yourself and for Safari Doctors.
Thank you, Indrani, and all the best to everybody on board.
And thank you, everyone, for joining us. Before we wrap up, I would like to remind you that next week we would not have a webinar. Instead, we are going to host a live community session on the 24th of April at 11 a.m. ET. It's a live and interactive session, which is a chance for all of you to meet us and your peers virtually and to talk to us about your projects, your course insights, and plans to implement positive changes in your institutions and in your communities. So Natalie and I would look forward to meeting all of you and put some faces to your names on the platforms. I'm sure it will help you to engage with all of us, all your peers, and us better in the discussion forum. So mark your calendars to be with us and do join us. Thank you once again, and we'll continue to talk to you in the discussion forum. Bye for now.